This week, let's chat about how pregnancy is so much more than just a prenatal. I am in a lot of holistic health groups and wellness groups and moms groups, and I love when there's a pregnancy announcement. The one part that I cringe about just a little bit, or maybe a lot of it, is when someone follows it by, hey, I just found out I'm pregnant, and what prenatal should I take? I cringe just a little bit, or maybe a lot. But it comes down to, we find out that we're pregnant 6, 8, 9, 10 weeks after conception. And within that time, so much has already developed. So much vital things have already developed. The spinal cord has developed, the brain has started to develop, the organs are starting to develop. In that first, trimester, it's so much of the structural things that are developing, whereas in other parts of pregnancy, it's more functional things. So it's super important, any part of pregnancy, to have a healthy pregnancy. Preconception is so vital for all of that, but we're missing some of the points if we're not taking our prenatals beforehand. Now, I don't necessarily recommend a specific type of prenatal. With the couples that I work with, it's all about baseline health. So it's about having the right nutrition and supplements beforehand, before pregnancy. And those are the same ones that will typically continue through the entire pregnancy. We really don't change a whole lot. But there's not one like specific prenatal that I'm like, you should take this one. Now, if you are looking to take a prenatal or have taken a prenatal, why not start it while you're trying to conceive, especially with the intention that if I am looking to conceive, then I will be taking that prenatal. So if I happen to conceive, I'm already taking the prenatal and it's all good, right? So no surprises there. It just blows my mind sometimes when I'm like, 6 to 8 weeks, we already had so much that developed. From the chiropractic standpoint, I've seen lots of times when we've taken x-rays, something called spina bifida, where at the base of the spine, that sacrum, kind of your tailbone area, isn't fully fused together. And sometimes it can tie into spinal pain, but it can also tie into nerve related stuff, depending on how it fused or did not fuse properly. And some patients, we find it on x-ray where they have no pain whatsoever in their low back. It was just like an incidental thing. Maybe we're taking an x-ray of the lumbar spine. They have pain higher up, or, hip pain, and it's not necessarily in that area of their tailbone per se. So I've seen that in patients, and it stems from birth. So it's in that neural tube. It's when it's developing, that spinal cord. And most of this is developed by 28 days from conception. So a lot of women don't know within that first month that they're pregnant. And I feel, based on what I've seen, is that just so much of it comes down to nutrition and nutrients, mom and dad helping that baby grow and develop the best that they can prior to even conceiving. So that's what I love doing, is helping couples on their journey with this, just because I see it so vital. From the chiropractic standpoint, the neurological standpoint, that epigenetic standpoint, there's just so much benefit to working on your health prior to having a baby. So much more than just that prenatal. Now, the other thing to note about prenatals, or just in general, the nutrients that are so vital before conception, are baby kind of steals. Baby steals from mom a lot of her nutrients. Baby's not the best raising to utilize, but baby takes a lot of the nutrients from mom during the entire pregnancy, as well as postpartum. So especially if mom is breastfeeding, baby's going to take a lot of that nutrients from mom. So we talk about postpartum depletion. That can go anywhere from day 1 all the way to 10 years after having a baby. And the peak is about 4 years out of after having the baby, but it can go up to 10 years. And especially if you're having multiple babies, back-to-back babies, you can just be in postpartum depletion for a very long time. So it's no wonder that 4th trimester that women are just having such a difficult time, either mentally or physically or both, just worn out and all those different things. So I really feel that having the proper nutrients before you even conceive, so that baby can steal some nutrients, but you can still keep some of your nutrients as well, is so vital, just for overall function and health of mom, baby. It's vital. It's very vital. One of the other things to consider on your pregnancy journey is doing a little research, finding out what you like and don't like about the whole pregnancy aspects of it. Especially if you've had kids before, you kind of know what you like or don't like. potentially. If you have had kids before, then it's all new to you, but doing some research, finding some blogs, finding some podcasts, asking friends for positive, uplifting stories, of course, because there's a lot of negative ones out there. But finding out, do you want a midwife? Does that make the most sense to you? Does it make the most sense to have your baby at home? Would a hospital birth make the most sense? Who do you want in the birth room with you? Do you want all of your family there, extended family as well? Or do you want it just you and your partner? Do you want the kiddos in there with you if you have other children? So it's thinking of those things of what does that pregnancy, what does that birth look like for you? Because 9 months is not that much. Once we find out that baby is on its way, it goes by so quickly. So finding out some of those things that you like will help you in the long run of having the pregnancy that you dream of and having the pregnancy that you would like. Now, I will say, during the podcast when I interview the women about their different journeys, baby does come how baby wants to come. So we can't always plan and prepare for everything. But I think having some ideas of how you would like things to look can be very helpful to have a smoother pregnancy and delivery, to have a blissful pregnancy. And the last thing I would love for you to consider of your pregnancy being more than just your prenatal is the 4th trimester. So when baby comes out into the world, looking at what that will look like for you and your partner. If you have other kiddos, what that will look like. Will your partner be taking care of the older kids while you are nursing or feeding the newborn? Will you be doing the cooking and he'll be doing the cleaning? Or taking out the trash? Like, what types of chores will you be doing? Will things change? Will they change if you have a vaginal birth or a C-section? So having some of these discussions with your spouse or partner can be very valuable in knowing what to expect when baby does come into the world. One of the other things I love about prepping for this 4th trimester, I think it's a newer thing. It's kind of like those baby pregnancy announcements where we find out what sex the baby is or gender the baby is the nesting party. So coming together with your community of girlfriends and cleaning the house, setting up the nursery if you have a nursery, learning tips and tricks on, what can happen during those first few months of having baby in the world for you, and planning meals, helping cook healthy, nutritious meals and freezing them so that it's easy access for you to be able to have a healthy meal once baby comes in the world. Because the first couple months, especially if you're a new parent, can be a little crazy at times, or a little different, or a little new, or there's so many different things that it can be for you. But one of those is it doesn't have to be difficult in terms of food. It doesn't have to be difficult in terms of asking for support from your community, from your family, from your loved ones. So those are some things that I really have loved about interviewing and finding out from couples and people I work with is that 4th trimester, really thinking about what that looks like as well. Because sometimes we just get so in our head about how the pregnancy is going to be and baby coming into the world and getting the nursery ready and all the things, but there's so many other things that also are very valuable and important to think about. So those are my thoughts for you this week on how pregnancy is so much more than just a prenatal and which one do I take. I hope you have a great week. Bye.